Cultural Competency in Social Issues by Gabrielle Durocher. Culture. Some factors that may influence cultural competency in nursing include cultural assessment and knowledge of practice issues. Cultural assessment includes self-evaluation of own beliefs and values. This gives a different perspective of patient beliefs and values. Knowledge of practice issues. Certain groups may feel as though they do not have the same access to healthcare. Nurses should advocate and reach out to groups with these issues to contribute to cultural competency. Diversity in the workplace. Cultural competence is the ability to understand as well as communicate and interact effectively with people of different cultures. This involves developing positive attitudes towards differences, gaining knowledge of different practices, and being aware of one's own views of the different cultures. The BSN Essentials emphasizes the need to focus attention on diversity to provide safe, high-quality care. Becoming culturally competent begins with cultural awareness. Ultimately, this enables a sensitivity to and acceptance of those from different backgrounds. Benefits of being culturally competent include mutual respect between healthcare workers and patients, increased trust between patients and workers, promotion of patient empowerment in their own care, and improves access to quality care. Cues and competencies. Cultural diversity and social issues can be directly related to CUESN through patient-centered care. Our skills and attitudes affect the care we give to our patients. We should implement patient values and preferences within our care and should effectively communicate with our healthcare team these values and preferences of our patients. It is also important for us to recognize our attitudes when providing care to different ethnic, cultural, and social backgrounds. Social issues. Some social issues related to healthcare include joblessness, homelessness, poverty, limited access to health insurance, and limited access to health care. This can lead to hopelessness, anxiety, depression, and despair among these groups. All of these issues can also lead to substance abuse, violence, or even crime. Diversity in social issues. Social issues and diversity in the workplace can be related due to the attitude workers have with their patients. It is important for patients, no matter their economic or social status, be treated with the same respect and high-quality care as any other person.